In other news, more people are landing in hospital for moderate or severe trauma injuries from incidents, such as falls and road accidents. For every 100,000 people, 148 of them were injured in 2021. This rose to 166 in 2023. To tackle the increase, a national roadmap is in the works to help stamp out common causes of injuries. The move is led by National University Hospital, which has a key trauma centre, as well as KK Women's and Children's Hospital. They have jointly launched the first National Injury Prevention Conference, bringing together various government partners such as the Health and Manpower Ministries and Road Safety Council. One aim is to drive potential law changes and address common causes of trauma injuries like road safety.
Even as there are ongoing efforts on injury prevention, we can continue to do more. And this conference brings together various stakeholders to better understand trauma trends and to reduce the incidence of trauma injuries. Ultimately, we seek to improve safety in areas of pediatric, workplace, and road safety at this conference. With sharing of knowledge and best practices, and through partnerships, we can all prevent injuries.
As we only see the patients after they have developed the injuries, we always question whether we could do more to prevent these patients from getting injured in the first place. So this national roadmap will be highly needed for us to have a very comprehensive national framework in order to reach out to all these people and prevent further injuries from occurring in our population.
About 1 in 5 persons with severe trauma injuries die from it. And this is according to latest data from the National Trauma Registry, which collates information from 9 public hospitals across Singapore. Now, let's take a look at some of the trends from 2021 to 2023. Out of 100,000 people, around 8 would be treated for trauma injuries at public healthcare institutions daily. Now, these range from minor injuries like sprains to severe ones like amputations. The leading cause of moderate to severe injuries among adults is falls, especially at home. And this is followed by vehicular accidents. Motorcyclists make up nearly half of such cases. Those working with tools and objects for work also made up a fraction of these injuries. Now, for children, falls at home are also the most common cause of moderate to severe injuries. But many children are also falling at school. On the road, most children injured are either cyclists or pedestrians. Some are also passengers. Around 1 in 10 kids are also injured from drowning, with over half of it happening at private pools. Our reporter Sabrina Ng speaks to one family who had to rush their young daughter to the emergency room after she swallowed over 60 magnetic beads.
Like many children her age, 9-year-old Madhivandana enjoys her toys. But when she was just 4, playing alone with a magnetic beads puzzle almost killed her.
I was just forming a star or apple or just... Then after that suddenly I wanted to swallow that one. Then I swallowed it. Then after that, few days later I was vomiting.
Her family rushed her to a nearby polyclinic, where an X-ray revealed she had swallowed over 60 magnetic beads. The balls were also stuck together in her intestine and could create a potentially lethal bowel twist. Madhivandana was admitted into NUH, where she went through emergency stomach surgery to remove the beads.
When I saw her first time, really I lost my confidence. I was too much worried because she was very young. At this age, she has to go through the abdomen surgeries, unimaginable. So I was a bit worried and too much stressed.
The surgery went smoothly and Madhivandana was discharged after 2 weeks. While the young girl is now healthy, a scar across her tummy serves as a permanent reminder. That period of time was also difficult for the family to look back on.
It makes me feel that I shouldn't even have played with that thing in the first place. Because I was the one, because my parents hid it somewhere.
5 years on, the family says they have learned a valuable lesson on safety, one that will never be forgotten.
And to tell us more about trauma injuries, I'm joined by two experts in the field. Adjunct Assistant Professor Raj Menon, who is Centre Director at the National University Centre for Trauma. And also with me is Clinical Assistant Professor Ronald, who is Senior Consultant at the Department of Emergency Medicine at KK Women's and Children's Hospital. Now, Dr. Tan, Dr. Raj, thank you for joining us in the studio. Now, we saw that package earlier. It's really every parent's nightmare to hear this happen. Let's start with you, Dr. Tan. Is this typical and common in terms of cases that you've seen every day?
Yes. So I work in a busy pediatric emergency department, and we see trauma cases every day. These may be very severe, such as drowning, falls from heights, and road traffic accidents. And really, the common denominator is that these are highly preventable.
And Dr. Raj, is it also similar in your case where you do encounter such cases of severe trauma injuries?
Being in the western part of Singapore, we see a preponderance of industrial accidents because we're so near the industrial heartland, and the numbers are staggering and the injuries are severe coming from the workplace from the workplace areas. The other major group of patients that we see are those involved in road traffic collisions, simply because of the confluence of the various expressways near our hospitals. And as you can see from the rates, you can see that the rates have been going up, especially in terms of road traffic collisions and falls. And you add in another aspect to this is that the type of patients getting injured are also getting older. We're seeing more frail patients, we're seeing more elderly patients getting involved in accidents which may not have otherwise have been so significant, but now because of their age and their frailty, they are getting more significant injuries, and that complicates matters significantly.
Well, we want to get into that, specifically the falls for the elderly and in children as well, in just a bit. But Dr. Raj, can you tell us why you think the number of falls and cases in hospitals, we're seeing people hospitalized for it, why is that going up?
I think, again, it comes down to a little bit of the population itself as the population gets older. But we're also seeing this in the younger groups in the workplace, in the workplaces as well. And to me, this is about safety awareness. This is about having a very high sense of something can go wrong and I better take some precautions to prevent it, rather than going the path that let's just get the job done as quickly as possible. And when people rush, when people try to achieve more that they can do in a short period of time, that's when accidents happen. And when people reduce their safeguards, this is really the perfect recipe for accidents to happen. And again, as Dr. Ronald was mentioning, very preventable with the right attitude.
Dr. Tan, I want to get to you as well and what you think. Children especially, that seems to be a group of people that are affected a lot by falls, as seen in the report. What are some ways that viewers can help, not just the children, but also, as Dr. Raj mentioned, the elderly, prevent falls?
Yes, so there are many things that parents can do. So because many Singaporeans live in high-rise flats, what would be a good thing would be to install window grills on the flat windows to prevent people from falling out of the windows. And indeed, our data do show that there are people who fall out of windows.
Are there other things that people can do, especially with road safety, as you mentioned, Dr. Raj, and also in the workplace? Are there individual precautions that people can take?
I think when you talk about road safety, I think being very aware that every moving vehicle is like a loaded gun. It can go off at any time in the right circumstance. Being very careful and making sure that you adhere to all the safety precautions like wearing seat belts, not just in the front, but in the rear as well. Avoiding speeding. And we are still seeing a high rate of people getting involved in accidents after speeding. These are things that, again, both from an angle of education and enforcement, and perhaps some form of engineering, we can help to reduce as well. And I think certainly in the area of falls, for the elderly group, we see patients falling at home. And this again can be avoided by strength training, by ensuring that there are proper grip bars all around the home. These are simple modifications that can really go a long way in preventing people from falling in the first place.
And that prevention on the individual level is quite important. But also, what do you think the National Injury Conference can do to help bring down these trauma injury rates?
I think the main focus of the National Injury Prevention Conference was to first establish a common platform for the various stakeholders involved in trauma care and trauma injury prevention to come together to share data. I think data is a very important aspect because it allows us to focus our interventions into where it's needed the most. The National Injury Prevention Conference is meant as an annual iterative conference where we build on the data that we've looked at, the interventions that we're going to be performing the year ahead, and then building up on that. Having this platform is really very critical to create a national framework for injury prevention. And I think that's going to help a lot of the stakeholders, be it the ministries, the statutory boards, and the public hospitals to craft their messages and their interventions going forward.
And speaking of the national approach as well, Dr. Tan, a national roadmap is in the works. What do you think can come out of this, and what can we expect from various stakeholders here?
Yeah, so I think it is really important that we forge a common consensus among the various stakeholders on meaningful ways that we can engage and continue this as an iterative session every year. And it is an ongoing dialogue, both within as well as beyond healthcare.
And also, Dr. Raj, what do you think this roadmap can add, and what are some areas that can be focused on really?
Perhaps an example, if you're looking at workplace injuries, one of the main areas we were discussing today at the conference was simple things like evacuation, calling an ambulance, calling 995 when you get involved in an accident in the first place, not bringing the patients on own transports to the hospitals, because that already improves the chain of survival. Number two is teaching the workers on the ground and the supervisors how to manage injuries as they occur. And this really just helps to reduce the burden of injuries which are occurring. When we talk about road safety, I think a lot of it is involved with education, both for children and for adults. But more than that, I think it's enforcement. And I think we had a good, productive discussion today with the various agencies. What are the areas that we should be focusing on for enforcement, and what are some of the barriers to do that as well? It's not one simple solution. It's really of a whole of government, whole of society approach when we are talking about this framework.
Right, all stakeholders have to come together and be involved, and most importantly on the individual level as well. Yeah. Well, before we go, Dr. Tan, if you could give us a quick tip, for viewers who are tuning in now and they've watched the video earlier that we played, and they think, I want to protect my loved ones. I want to make sure that even if they do get injured, I'm able to get them into safe hands, right? So what are some tips you have for prevention or for recovery in this sense?
Yeah, I think first and foremost, what we really wanted to emphasize to everyone is that prevention is always better than cure. So let's have that safety mindset and, really just work together towards a safer Singapore.
Dr. Tan, Dr. Raj, thank you so much for coming in today and chatting with us on this very important topic. I've been speaking to Adjunct Assistant Prof. Raj Menon from NUH and Dr. Ronald Tan from KKH.